Hi, my name's Haley Cordell, and I'm with Youngstown State University's family nurse practitioner. I was just wondering if we were able to do an interview.
Sure.
Okay. So I just have 5 questions that I'm going to ask you about yourself and kind of like what your position is, specialty, some barriers, and whatnot. Does
Okay.
that sound okay?
Mm-hmm.
So just tell me a little bit about yourself.
Well, my name is Jessica Miller, and I have 4 children, 2 girls and 2 boys. I got started a little later in life, so I only became a nurse practitioner probably about 7 years ago. Um, so um, Before becoming an NP, I worked as a registered nurse on a med-surg unit where we had psych and detox patients on top of med-surg step-down patients. And I just enjoyed caring for the patients of all ages and the families. So I just wanted to kind of go a little further and help them with their overall health.
That's awesome. So how would you describe your current position now, and like what is your specialty now? Did you kind of go towards that detox psych, or you just family medicine, or
I decided just to go into like family nurse practitioner, just a family practice, like a clinic. That way I could see a majority of all people. I do see some children, adults, older adults. Um, I kind of see them for their annual physicals, their sick visits, chronic disease management, preventative care, and then just some regular like health screenings. I do diagnose illnesses, prescribe medications, order and interpret lab tests, and then I educate the patients on just their healthy lifestyle um, living. If it is like a patient having substance use disorder, I kind of try to help them with finding resources, getting them set up with facilities to help if they need like medical management for like Suboxone or methadone. I get them to where they need to be for that as well.
that's awesome. So you kind of see like a whole realm of everybody.
Correct. Kind
Okay.
of keeps the day busy,
Yeah.
interesting.
Yeah. Well, how long do you normally work for?
Our practice is open 8 to 4, and then after that, I kind of just finish up my notes and if there was anything I didn't get to throughout the day, calling people back about like their test results, stuff like that.
Okay. Do you see like APRN influence in today's healthcare system? If so, how?
I do see that it is a big role in just improving the access to healthcare. I know myself, sometimes I have to wait 6 months just to, um, like, I just tried to get an endocrine appointment. They told me it was 6 months out. I think if we can continue to get NPs into the field and help with like the provider shortages, that will help. It will help reduce wait times, manage chronic conditions, provide preventative care, and just build stronger relationships with the patients.
Yeah. Do you see any barriers that like you face or like other APRNs have faced, like being in the field, whether it be like inpatient or in the hospital or really anywhere where they may work?
I think some barriers are just like practice restrictions in certain states, lower reimbursement compared to physicians. We're just not at that level yet. And then misconceptions about our education and our skills. These challenges can limit the care to the patients. Some patients only want to see a doctor because they don't feel that um, we have the knowledge to be able to treat them. However, I find it different where I would rather go see an NP or a PA because it seems like they're more involved with their patients than
Mm-hmm.
just the doctor. The doctor goes in, writes on the little computer, and says,
Right.
"Okay, great, have a great day," and you're in them
Mm-hmm.
for like 5 minutes. I try to spend at least 10 to 15 minutes with my patients. I know time is still a restriction, but at least trying to get that care where you can kind of talk to them and get to know them a little bit better helps with them actually complying with the
Yeah.
medications and the management that you're trying to do.
Establishing like that rapport is really good. Um, and then what kind of changes would you like to see made for APRNs like in the future? Like, is there anything that you ever wanted to implement yourself?
I think I would like to just see full practice authority in all states, so practitioners can provide care without unnecessary restrictions. I also think improving the reimbursement and increasing the public understanding of what we do would help straighten the profession and expand access to quality health care. Um, just kind of getting the name out that we are educated, we can help them. And in the long run, it's probably going to be more NPs and PAs at the bedside than actual doctors um, bedside in the office, just because of um, a lot of doctors don't like that med school anymore. It's easier for us to, get our education and start practicing sooner than it takes a doctor 8 to 10 years to get to start practicing.
Right.
So I think just overall, just trying to help everybody see a provider faster would be great.
Yeah. Well, thank you. Do you have anything else to add
I
about
don't.
your position or anything like
I
that?
don't think so. Good luck in your field, and I hope you really enjoy it.
Thank you.
You're welcome.